Good morning, everyone. I'm Akash Lopinder, and this is your morning edition. 2,428 tests conducted here in the Bahamas as of yesterday, but this by no means translates into the number of people tested overall. And this based on the fact that in some cases, COVID patients have had to be tested 5 to 7 times in order to be declared recovered. So says COVID Chief Advisor Dr. Mercelin Dow-Regis, who understandably welcomes the donation of some 10,000 kits from the Turks and Caicos government, enhancing the Bahamas' testing capacity.
We also have on hand equal number of swabs. I may be not quite accurate on that because we use our swabs so often. But we have certainly more swabs than we had initially and during the midway. What we also did was anticipating that there may be global shortages. We attempted to front load our supplies, given that the shelf life of these agents and reagents do not expire.
Testing, as has been explained, anyone coming into the country must present a negative PCR test. This as health officials accept that while the Bahamas cannot eliminate the introduction of COVID-19, it can reduce the risk as much as possible. According to Dr. Sharita Moxie, that calls for developing a risk strategy that identifies variables rating travelers.
For example, if a traveler is coming from a country where there is a high level of community spread versus a country that has minimal to low or no community spread, then those particular travelers receive a different rating or a different score and have a different risk level associated with them. So as we look at what is going on in the international space, in the global space, we take all of that into consideration. But as DG Jibrilu indicated, the mechanism that we have working in the background is quite a robust one that takes in several different variables, several different factors to identify those high-risk travelers who will not receive a health visa, those medium-risk travelers, and those low-risk travelers.